Hi, my name is Dr. Brian Walkwitz, and I am the owner and dentist at Howard Dental Center. And this is a short video about our unique approach to dental care and how we help people set a new direction for their dental health by giving them a real choice. To develop an understanding of what I mean by choice and what I mean by new direction, it helps to understand the traditional model of dental care. And this is the typical experience in a dental office. This is how we're trained to provide dental care, and this is how 90% of us do it. So your typical experience may involve coming into a dental office with some sort of dental problem, which would be the symptoms. So anything you experience or are aware of going on in your mouth is a symptom. The doctor will then do a quick exam to check out those symptoms and maybe find some other issues, but anything that they see either related to your symptoms or anything else that they see as far as effects are signs. But signs and symptoms are both just effects of disease. Now in this model, diagnosis is just limited to defining that disease, really just to giving it a name. But the diagnosis that we use really doesn't give any sort of contribution to how we treat the effects of disease. So instead, what we're really focused on is finding signs, finding symptoms, and then finding solutions to repair those effects. But unfortunately, because no one ever really looks at the causes of the disease, the causes of those signs and symptoms, those effects just recur over time. So we ask, what is it? What's going on? We ask, how can we fix it? But what we really need to ask is, why did it happen? So the result of not asking that very important question and not addressing causes is that patients will experience over many, many years cycles of this disease and repair process. And the more times that we repair the mouth and disease recurs, the mouth breaks down a little bit more, and a little bit more, and a little bit more, and a little bit more. So ultimately, the result is frustration. When people are forced to choose between dental treatment and dental problems, with no real light at the end of the tunnel, they feel stuck and trapped. So here's our model and what we try to do to break that cycle. On the right-hand side, you'll see the same three boxes as in the traditional model: disease, signs, and symptoms. But the difference is we start much further upstream. We start by studying and understanding ideal health. If we know what it is about the healthiest mouths that remain trouble-free over a long period of time, then we can understand what causes are for disease. Because anything that differs from those healthiest mouths is a potential cause that can produce future risk for disease and problems down the road. So our process starts with a co-discovery. And co-discovery begins with listening to your story. The better I understand where you've been and where you are now and what your goals and values are towards dental care, the better I can help you. But also, to tell your story is to hear your story, and it also facilitates your own understanding. The next thing we do is we'll teach you about health. So we'll tell you what it is about those healthiest mouths that keep them healthy. With that as a reference point, then we can teach you about the causes of disease. So anything that differs even slightly from that model may produce a cause which could increase your risk to develop disease in the future. Then we'll go back to the operatory and we'll do an exam in a co-discovery format, which means that as I see things, I'm going to tell you and explain to you exactly what I see. So we're going to learn together at the same time. Then with that information, we can move on to co-diagnosis. So versus just labeling disease, which really isn't much use to you in particular, we're going to talk about this together. We're going to figure it out together exactly based upon what we found in the co-discovery, what causes are present. What is your risk for disease, and what is the present state of disease? From there we can move into co-creation, and here's where we get to choose a direction and choose a plan to help you get to where you want to be. So you may choose to stay in the path that you're on and just remain in that repair and disease cycle and deal with the consequences as time goes on. But if you want to work further upstream, we can do that too. We can use that risk information to design preventative strategies that address the causes of disease and help stop that disease process in the first place. So whatever you decide is your choice. You may choose health, you may choose something else, but we'll co-create a process to get you to your goal at the pace that you desire. So at this point you may be asking yourself, is health realistic for me? I've been in this disease repair cycle for a long period of time. I've had a lot of dental work in the past. Can I really get to an ideal point where I don't have to worry about dental problems? The answer is yes and no. And to understand, you really have to know that there's the normal mouth, the normal situation that we've described, this disease repair cycle, breakdown over time, and then there's ideal health, or that ideal model. Now everything that's within this pyramid is reality. This is what we can achieve. Ideal health is the perfect mouth as nature intended it to be. So it's not repaired, it's normal unworn tissue, normal and healthy bacterial levels, and a healthy pH and chemistry to the mouth. So if we've had wear and breakdown, obviously we can't regenerate the mouth to that ideal healthy state, but we can still use that as our guide. So first of all, we can create optimal health. Now to me, this is optimal chemistry in the mouth, meaning pH or acidity level, and that lends itself to a healthy bacterial population, so that the good types of bacteria versus the ones that cause the problems. When we have that as our foundation, then we can create optimal form in the mouth. This involves restoring the teeth to their right size and shape and restoring the chewing system to its ideal function and form. When we have optimal health, we are resistant to gum disease and decay. When we have optimal form, we're resistant to tooth wear, to jaw joint and muscle problems, and breakdown of the system as a whole. So when people understand this, they can choose their direction. We can either remain with the normal model and head further into disease and need more repair over time, or we can change directions and try to head into this healthy range, where optimal health creates a situation where we can be resistant to dental problems and dental treatments. And as soon as people make the choice to move in that direction, their risk level already changes. So what we really offer people is a choice. And a choice first comes from understanding where you are and where you're headed in all three phases, in all three diseases that we talk about: gum and bone disease, tooth disease, joint and bite disease. So knowing what the disease level is, knowing the causes in your specific situation, and what your risk is for further problems. The risk is basically what tells you where are you headed, where are you going to be in 10 to 15 years without any action. And then we can show you an alternative, and that's optimal health, as we discussed. And when we show you exactly where you are headed, and an alternative path, then you have a choice. And with that choice, people usually make good decisions, and many people will choose to pursue optimal health. And that's where real commitment comes in. And it's that commitment that drives us forward to achieving it. So that's just a short description of our approach, what makes us a little bit different. If you'd like more information, visit our website at howarddentalcenter.com or give us a call at 920-434-4165, and we'd be happy to assist you. Thank you.